Welcome to Animal Care Unleashed with Sonia. I'm Sonia Maiorano, Field Placement Advisor for the Animal Care Programs at Conestoga College. I'm also a registered veterinary technician, a certified canine massage therapist, an Ontario certified instructor post-secondary, and a proud member of the ASMVT. But most importantly, I'm your host for this video series where we connect with professionals who inspire and guide our future animal care leaders. So today, I'm thrilled to welcome Laura Brushett, a registered veterinary technician with her VTS in emergency critical care, which is specialty. Laura started off her veterinary technician career in emergency and critical care right out of school. The passion was ignited within a large-scale veterinary emergency and referral hospital in the GTA, and she quickly advanced from positions within the ER to ICU in a short period of time. She pursued the veterinary technician specialty in emergency critical care in 2017, and since then has been promoted to technician lead and subsequently to department manager. Her passion lies in furthering technician education and advancement, as well as delving into the pathophysiology of diseases such as Addison's, DKA, sepsis, and shock. She also loves to flex her skills with mechanical ventilation, transfusion medicine, and putting tubes into holes. Laura has now stepped out of primary management to explore her passion for education. She has now written 2 articles at the OAVT in their journal, lectured virtually, nationally, and internationally at various veterinary conferences, and has stepped out into the professional role for Conestoga's new animal care programs, developing courses and teaching pet groomers, veterinary assistants, and veterinary technicians. Her focus is teaching on animal care professionals to be contributing and collaborative members of the animal care team and to never stop learning and have some fun along the way. So thanks for joining us, Laura.
Hi, thank you for that amazing introduction. It's always funny to hear someone talk about yourself, but thank you for allowing me to join today.
Thank you. So we're going to start with your journey. So what inspired you to specialize in emergency and critical care, and how did that lead to your current role managing a busy emergency hospital?
Well, I did GP in smaller animal hospitals while I was in school, while I was assisting. But then throughout school, I wanted just something different. And in emergency and critical care, you essentially never have the same day twice. And that's what I love. That's what I love about this area of veterinary medicine. I love the environment where there's a lot of spontaneity. And a lot of variation in cases and skills, and you see a jam-packed array of diseases, different surgeries, different gross things, and it allows you to kind of apply a lot of your skills. And I knew that was the avenue that I wanted to go into. And over the years, I think I worked really hard to kind of build my skills and learn from everyone around me. And that kind of led me to naturally train new employees, get involved with developing programs and SOPs in the hospital, interviewing new staff, doing working interviews. And then I also kind of tried to be myself, tried to be approachable, tried to learn different teaching styles, tried to learn and, provide no judgment. And then after several years of that, I guess they noticed and I became a team lead. And then when the opportunity arose, I seized at the chance to become a manager and try and jump into that kind of avenue. And I think I got that position from a lot of the stuff I just mentioned about, but also because my team trusted me and felt that I was approachable. I understood the needs of the team. I understood the workflow and operational demands, and also having the skill set to back that up. So I think kind of that's how I navigated from my tech journey as a student to tech to lead and manager.
That is an incredible path, Laura. Oh my gosh. So I guess what my leading question is going to be, when it comes to building your team, what qualities do you look for in veterinary assistants and technicians during your hiring process?
Yeah, I think it's tough because a lot of people can be a little nervous about jumping into an emergency hospital. And over the last kind of 10 years or so, I've interviewed a lot of different people in a lot of different jobs. Some were great interviews, some not so great. But overall, I'm a firm believer that I can teach anybody a skill. I can teach you to hold, I can teach you to place a catheter, I can teach you to follow this SOP protocol. But so it doesn't necessarily mean you have to have all the skills. If you come with them, that's great. That's a bonus. But even if you're limited on skills, that's still okay. As long as you're wanting to learn, as long as you show up with a mindset that you're willing to learn, and also it's key that you're willing to adapt some of your current techniques, and are open to, and you're open and willing to learn to work with others. Those are all things that I look for in any employee that I'm trying to hire. And it can be tough to have all the skills, and then also trying to navigate how to fit in, and also be open to like learning that maybe your skill is not what it needs to be at this facility, and being okay with learning how to adapt your catheter taping, learning how to adapt your restraint techniques, and kind of leaving your ego at the door. And that's really important when you come into any position or any job, no matter your skill set. But I kind of always want to just have that inquisitive nature and want to learn more, and being able to accept that, hey, I'm a sponge. Please teach me what you want me to know, and I'm an open book, and being willing to learn.
Great. Okay, we're going to just flip a little bit to, we'll talk a bit about hard skills and soft skills. So speaking of hard skills and qualifications in particular, do you look for certain technical or clinical skills that are like absolutely essential at this point in time in emergency setting for success?
I would say yes and no. So I kind of, when I interview, let's say a technician or a new assistant, I always ask them, tell me what you do in your day-to-day job currently, and seeing if kind of we match up, and what they can bring to the table. But I think, like I said, I'm always wanting people to be able to learn and basically like learn new skills. But for an example, there's a lot of skills, as you can probably imagine, that a technician needs to do to be successful in an emergency setting, right? In the long run, in their lifespan of being a tech. But ideally, we always want to be able to take blood from a vein. We always want them to be able to place an IV catheter, be able to do a physical exam. And that's kind of the basis. Everything else I'm willing to kind of teach and navigate along the way. But right now at my hospital, we do have a basic set of skills. It's about 35 to 40 skills long. And that's just a starting point where all of our technicians should at least master or have those capabilities within the first 6 months. And if they have those on day one, that's amazing. We can always branch out and expand from there. But a lot of them are very basic, like using monitoring equipment, knowing your different tubes, veins to take blood from, restraints to do, and things like that. I think more importantly than technical skills is that critical thinking skill. I think for me that is a very hard skill, more of compared to a soft skill, but the ability to think critically is kind of the most essential thing. And that means using all your skills together, from assessment to treatment, and looking at your patient as a whole. And sometimes I can figure that out as I ask them questions during the interview. But it's definitely one really good critical hard skill that I'm looking for in a technician, or even I don't know, or even like the assistants.
Gotcha. So on the flip side, as I know you previously touched base a little bit on it, soft skills that often make or break a candidate when interviewing. So which interpersonal or communication skills do you value most in your team?
I think the ability and the comfort to talk to owners. I think a lot of us we always joke, we go into vet med because we don't like people. But unfortunately, we have to communicate with the people. The people have the dogs and the cats. The people have, we have to be able to communicate with them. So for me, being able to assess new hires and how they potentially could communicate with owners is really important. And so much what we do is talk to owners, educate them, review with them, take histories, tell them how to give meds, call them over the phone, all that stuff. And I always try and assess that in an interview, and get their thought process for certain situations or certain scenarios that I will ask them. And that tells me how they might think on their feet. That might show me how they adapt their thought processes and how inquisitive they are. And if this is done well, that usually shows me that they have a good communication style and they will generally probably do well talking to owners.
Oh, that's great. So emergency medicine can be unpredictable. So as you would know, so how important is adaptability and how would you assess that during an interview?
Yes, I agree 100%. You have to be adaptive, you have to be resourceful, and nothing ever goes the way you want it in ER. Animals don't read the textbook. They don't respond the way you want them to. Also, equipment, things in your environment don't always go the same way. I think the way that I kind of assess that in an interview is try and giving them scenarios that, not to scare them, but to set them up for something that might happen. So a scenario might be something like they're coming in for your shift and you find out that your shift partner called in sick. And then as you're listening to rounds, you start to get overwhelmed with the caseload that's in front of you and all that needs to get done. And then what are your next steps to get through the next couple hours of your shift? And I try and pose these scenarios, not that it happens every day, but to kind of get their response, get their problem solving skills, and how are they going to adapt that particular situation. So that's kind of some different situations I might ask them during an interview to assess their adaptability and being resourceful.
Gotcha. So I know with some adaptability, there's also a part of it, which is team dynamics. So working in emergency care means obviously collaborating under pressure. So what do you look for in terms of teamwork and conflict resolution abilities?
That sometimes can be harder to assess in an interview because everyone's on their best behavior. And everyone will give you like the textbook answer. I find sometimes that's easier to assess on a working interview, so you can kind of see how they communicate with each other. But on a day-to-day basis with my team, or even like shift by shift, I always want people to be able to communicate effectively on all levels. Some people get really nervous about talking to a doctor, or they don't necessarily feel comfortable talking to the receptionists and things like that. So generally in a working interview, being able to talk in amongst each other is really important. And then overall, as an employee, I'm always wanting to make sure that people, if there is conflict there, address it head on in those moments. So that way it doesn't interfere with communication or pet safety or completing tasks. Because sometimes what happens in certain personalities is things go unsaid and then build up, and then things don't get addressed in those moments. So it's definitely really important for kind of conflict resolution to be able to address those things head on when they come in. But it's tough. It's always tough to assess that on an interview. It's probably one of the harder things that I think I can kind of get out of new applicants.
Gotcha. So professionalism is key in any veterinary role, obviously. So how would you gauge a candidate's professionalism during your hiring process?
I think a lot of that starts from the moment that we have an interaction, whether that's a phone call, a Teams call, an email interaction. It's being it's professional communication. It's responding back. So those are the little nuances that I kind of pick up from the beginning. When they come in the door, are they wearing appropriate attire? And that's okay to wear scrubs. It's not a big deal. But how are you presenting yourself? Are you punctual? Are you interacting with the staff in any way? Is that the reception team? Are you making eye contact with people? So those are things that I kind of pay attention to, and I think link back to someone's professional and work ethic. So that's kind of the first thing. I also kind of look at, are these applicants being prepared for the interview? Do they know about the job? Do they know what we do here? I remember there was one person who came in for a job in the ER, and they were surprised that the job was 24/7. Like the hospital was open 24/7, and we see things overnight. So being prepared, knowing what you're coming into, and then coming with questions prepared. I always love to see that. That means to me they did their homework. That means to me that they're actually interested and invested in that position because they were able to think about things that they wanted to ask me. So to me, that means and shows me that they're professional.
Absolutely. So my next question is more lean towards the growth mindset. So veterinary medicine is always evolving. So Laura, how do you identify candidates who are committed to continuous learning and professional development?
I always love it when I get a positive response with this. So we ask, our hospital has what's called an internal advancement program. So on interview, we discuss with them those skill sets. So we have our basic skills, we have our intermediate skills, and I usually run through that as requirements for this job. You're expected to do these skill sets, and then demonstrate and write a test on these skill sets. And that is a requirement for all our technicians. We have a more minor one for our ACAs. And I explain that to them in the interview process. And I also discuss the benefits of our hospital and offering CE budgets. And if I get a response that's like, oh, wow, that's so great. I love that idea. Then I know that these are applicants that are committed to possibly continuous learning, professional development, and I get excited about that. And usually it does move forward and transition into their passion when they actually get hired. If I, on the flip side, discuss that and they get like, oh, really? And kind of seem a little like down about it, then to me, that means they're a little cautious or a little nervous, and maybe this isn't the right learning environment for them. So that's kind of one way that I can kind of approach the idea to them and say, this is your expectation upon hiring. Within the first 6 months to 1 year, complete these skill sets. And they're like, oh, wow, that's great. Then I know that they're like, oh, okay, they're self-motivated. They want to learn. They want to grow as a tech. So that's kind of one green flag for me, that they want to, have professional development.
All right. So as you're aware, Laura, with this interview, we're on, we're being televised. So for all the students and new grads that are going to be watching this, what advice would you give them to stand out in an interview for an emergency or specialty hospital?
I'd say just be yourself, and own what you know and own what you don't know. I'll tell you a story. So when I applied for my ER position in 2013, I was right out of school. And I was like, I'm not going to get this job, but I'm going to go for the experience. And I want to eventually maybe be here, but they'll never hire me. I don't know enough. And I remember the interview process, and I remember sitting down with one of the vets, and he would ask me like, oh, what's the difference between Ketval and propofol for an induction protocol for anesthesia? What's the difference between a Doppler and a Cardell for blood pressure monitoring? And when would you use one over the other? How would you identify a VPC on an EKG? And I remember just going, oh my God. But I remember saying, well, I have limited experience, but this is what I do know. I don't know exactly all the different EKGs, but I know what's normal. So I would then flag what's not normal. And I kind of owned what I knew, and I owned what I didn't know. And turns out they actually really valued that, and they appreciated that. and they saw that I was somebody that was coachable and honest and wouldn't just wing something because you asked me to do it. So I kind of went in there just being myself, saying that I'm a new grad, and didn't pretend to be someone that I wasn't. And so that kind of worked for me. And that's what I always tell people. I'm like, we're just going to have a conversation. I'm not trying to test you, but just be yourself and let's have a chat about what you want to do as a veterinary professional and see if we're a good fit together.
Awesome. All right, so your final insight on this, Laura. So if you could share one piece of wisdom, one tidbit of something about the, thriving in this field, what would it be?
I think the biggest part is just leaving work at work. I think in vet med, it's very easy to take a case home with you, think about 100 different things I could have done differently, or try and like figure out what you should have been better at, or how many times you missed that vein. And I think that can eat away at us. I know it has for me in the past. But I think overall, in order to, be successful and to maintain a little bit of your sanity, at least in the ER field, is once you clock out, you let it all go. You kind of talk about the wins of the day, what went well, and end it there. So that way you can, move on with your life and move on with your day and kind of build that resiliency. So that way you can have longevity in this field, and not take things home with you to dwell on, and kind of leave things on a positive note and what you were able to successfully do today. And that gets easier the more you practice it. It's definitely a skill set to learn. But I always say this, my advice for everybody is no matter how good or how bad your day was, clock out and let it go. Tomorrow's a new day, and we just got to leave work at work, and kind of always end on a positive note and what you were able to do really well.
Thanks, Laura. That's really good insight for sharing with our students. So thanks so much for joining us here on Animal Care Unleashed with Sonia. A huge thank you to Laura Brushett. Thanks for sharing all of your experience and insight. It's very appreciated. So until then, take care and keep learning.